I began to notice a difference in my vision. I began having a lot of cloudiness and fogginess and some difficulty driving at night. It's like a fog was there. So I called and I asked for an appointment and was determined that I had cataracts.
A cataract is the cloudiness of the natural lens inside the eye that happens with age and cause blurred vision, that the colors are dull, the patients don't feel like safe driving, and even reading or some activities can be difficult to perform because of the vision. Sometimes the patients don't realize, because it's just a slow and progressive process, that they are losing their vision.
Like with all surgery, you get a little apprehensive. I was real nervous and I really didn't want to go to sleep. These things we talked about, the whole process was explained.
Well, it's normal. It's normal to be apprehensive. So what I try to them is just to educate the patients about the surgery, about the safety, about my years of experience, and especially technology advanced so much now that it really that also bring into making the surgery more safe. In traditional cataract surgery, the patients use a different eye drops, prescription eye drops that they have to use during the postoperative period, different time and in a schedule. And we now are performing dropless cataract surgery that we inject the medication inside the eye or around the eye at the time of the surgery. And there's no need for eye drops, and that can be very helpful, especially in those patients that they're having difficulty instilling the drops by themselves to follow the schedule.
By not doing the drops was like another thing that was off my tray. When you're taking medication, anybody taking medication, when you add something in, you become extra traumatic. It becomes a little traumatic. You're like, okay, this is for this and this is for that. So by not doing that, it just alleviated a lot of personal concerns for me.
It also helped with the burden to go to the pharmacy, have the drops, financially, decrease the burden. Some of the drops, the copays, the insurance, they can be costly. And on the physician side, we know that the patients are receiving the medication, so also help with the compliance during the postoperative period.
And so therefore I went on, I had the first one, and that was a success.
Cataract surgery is the most common and successful procedure in medicine. We perform a small incision in the eye, we remove the lens, replace it with an artificial implant. The surgery takes about 20 minutes and the patients can go home after the surgery. Cataract surgery is extremely safe, and most of the patients, like 98% of the patients, they notice an improvement on the vision. Their vision is more clear.
And I noticed, she said, well, Ina, you don't need glasses anymore. You can now go and, in a couple of weeks and just get you some readers. I'm like, well, great. I was happy about that because I've been wearing glasses since I was a child.
Usually the patients go through a process that they get glasses and they feel like the glasses are not done properly because they still have some blurriness. And so when the patients feel like the blurriness is affecting the daily life, reading, driving, watching TV, or any hobbies, in general, that's the right time to have the surgery. It's not associated with the age. It's not like when you're 70, you have to have the cataract surgery done. It's more associated how that is affecting your, life.
Mm-hmm. And it's about beautifying yourself inside and out, your soul. You know what I'm saying? It's a connection between her, the staff, and myself. I would recommend precision eye care to anyone that's out there.